Today on CityCast Denver. Colorado has the highest rates of mental illness in the country, while at the same time, the least access to care. Susan Green recently conducted a 6-month investigation into our mental health care safety net for Colorado News Collaborative, and she's on the show today to explain some of the reasons why things are so bad. Today is Tuesday, January 4th, 2022. I'm Bree Davies, and this is CityCast Denver.
Sorry, my dog is, he's just aggrieved about the whole thing.
Sounds like it. Well, Susan Green, welcome to CityCast Denver.
Thanks, Bree. Good to be here.
So we're going to talk about a pretty major investigation that you spent over half a year working on. And I think that's where I want to start is, what led you to investigating Colorado's mental health care system in the first place? Like, what was the catalyst for your reporting?
I just kept reading year after year about how low we kept ranking nationally in terms of mental health indicators. Generally been in the lowest, among the lowest states for depression, for suicide. It's pretty bad along the spine of the Rocky Mountains, and not just, in agricultural communities necessarily, but also in sort of ski resorts. It's high in the Latinx communities. But I wondered if there were other factors at play that were adding to that. And so I just started looking into the community mental health centers, which are the 17 centers regionally that serve as the mental health safety net for the state. And I want to say, as I was working on this, we fell to the very bottom of the nation in terms of access to care and I think suicide. And so, we were like that before the pandemic, but obviously that pandemic exacerbates things.
This is such a juxtaposition to the presentation that Colorado is this place that, that folks come for recreation, or like we're super quote unquote healthy in these certain ways. But underlying that, it sounds like there's a lot of other pressures that we don't talk about.
Yeah, I'm so glad you pointed that out. I think the same thing. It's and I think that the stigma is part of that, right? I was listening the other day to the Governor Polis, respond to a question about the Marshall Fire, and one of the reporters asked him, "How do you feel? This is your home county. How do you feel? You just flew over in a helicopter and assessed the damage." And his answer was so typical in some ways of Coloradans. He quoted some maybe coworker or colleague or someone he knows expressing her feelings about it, but not his own.
Governor, you've dealt with a lot of challenges in the past 2 years with COVID. You talked about what you saw from the helicopter. Can you let us inside the emotions of what you had to watch in that helicopter?
I of course have many friends in the affected areas. I just want to read a text from one that I got, a friend who lost their home, or doesn't know if they lost their home.
It's very rare that people in power and people in positions like the governor really actually do talk about their feelings at all. And of course they have them, but it's not necessarily a state where we discuss these things.
So last month you published the work of this 6-month investigation that you have done into Colorado's behavioral health system, and found, like you said, that Colorado has the nation's highest rate of mental illness, while at the same time the lowest access to care. What does that end up meaning for a person like Matt Vinola, who you profiled in your story?
It means that he kept getting rejected for care, thrown out. And there are many Matt Vinolas out there, right? This is the safety net system. They shouldn't be dropping people from care. and it drives Denver crazy when I say this, but finding reasons to drop people from care because it very much looks like they're trying to, right?
Well, and like, what happens when you drop somebody with serious mental health issues from care? They end up in our jails. They end up in our hospitals. They end up on our streets. They continue.
They end up
the
dead.
cycle. Yeah, they end up dead.
Yeah,
they continue these cycles where they have no support system.
Right.
And that's what this is supposed to be.
It got to a point where Matt Vanola had been rejected so many times, or like, they would call the police on him or whatever, right? Which would launch like a long incarceration and competency evaluation. Like a whole year of mess, right? That he wouldn't even work with them after a while. Like, of course, their trust erodes, right? Like, you have paranoid schizophrenia. You hear voices in your head. Like, let's be clear. Like, by definition, the hardest cases are difficult to treat, right? They're often delusional. Right. Like, they're wildly depressed. In less severe cases, it means you could be really depressed and have to wait, not just weeks, but I was talking in this series months, up to 11 months to see a psychiatrist, right? It means waiting months and months to get therapy. It means when you start therapy, it's very likely, let's go back to the stigma thing. We're a state where stigma is high, so it might be difficult for some people to talk about their personal stories and to sort of unfold them with a therapist. And it may very likely mean that you start doing so and you come back one day and that therapist isn't there and you have to start all over again. And that could happen to you. I found a woman in Aurora who had 8 therapists in 1 year, right? So it's like, how far can you really get, right? It might mean that you are a Spanish speaker and that these community mental health centers, which are supposed to be the safety net, literally don't have a Spanish-speaking, meaning fluent care provider. So, I found many communities around the state where Spanish-speaking folks don't even call their community mental health center. It's not even worth it to them.
And so I want to go back into where this all starts. Like, we have this safety net system with 17 community mental health care centers that are supposed to be providing care for people who are uninsured, but it's clearly not working. Why is the system like this?
Yeah. So in the 60s, John F. Kennedy, who actually had a sister who was institutionalized for mental health and behavioral health reasons, announced this initiative to deinstitutionalize the mentally ill and take care of them in community, right? And so they're sprung up around Colorado and the rest of the nation, these nonprofits called community mental health centers that were supposed to do this. And this is an incredibly tangled web of programs, state and federal funding. And so I think part of why this system has not been scrutinized, it's twofold. One is it's really hard to look into these centers because they're private nonprofits. And as private nonprofits, they're not subject to sunshine laws. So it's like we can't go and just ask them any question like we can, for the most part, with government and get answers. It's unscrutinized because the regulators, and I say that with air quotes, right? The people who are supposed to regulate them at the state really haven't been doing so. And they've been succumbing to pressures by the trade group that sort of lobbies for these centers, which is a huge part of my story, not to make them more transparent or not to have the state regulate them more carefully. And it's been unscrutinized because it's so damn complicated. And it does take like 6 months to for a reporter to get to the bottom of it, right? And we don't live in a time when there are a lot of reporters out there who have that kind of resource. So before I investigate anything, I always look to see, well, what's been done? And I'm amazed at how little scrutiny this system has had, frankly.
Yeah, it's so interesting. It actually made me think about when I was on Medicaid myself and utilizing the Mental Health Center of Denver, which was the only place that I knew about for folks who didn't have insurance. Everywhere else is $125, $150 an hour,
Yeah.
And I frankly, personally had a pretty horrific experience with a counselor there who was clearly going through the motions, filling out the paperwork, checking off the boxes. And it just didn't dawn on me until later on when I was insured and I had an actual therapist that I was like, oh, they weren't doing anything for me there. And I was a light, quote unquote, light case. You know what I mean? Like
Yeah.
I wasn't having suicidal ideations. I wasn't without economic support. You know what I mean? I was pretty okay. I can't imagine.
Yeah, I'm so glad you said that. This is a little bit like the public defender's office, right? Like
Yeah.
clinicians start their careers often at these centers, and they have, I think I quoted a woman who had something like 80 cases. And so it was really hard for her to remember, like, you know, people's issues, you know, and really how much can you really handle in terms of people's stories and the details and the relationship that you create with each of these people. So I'm so glad you said that, because I think that often the kind of, again, quote unquote, care that people get does not approximate what people who have had care outside the system expect. And I think that's a really interesting public policy question to ask. I mean, again, assuming these are the hardest cases, and it's not an assumption, they just flat out are. Is that okay?
This episode is brought to you by Choir League. Choir League presents Sing and Shout, an unforgettable afternoon celebrating the powerful legacy of African American spirituals, the foundation of all American music. On Sunday, May 4th at 3:30 p.m., join Lonnie Norwood, gospel singer and teacher from the South Side of Chicago, for a workshop and performance with Choir League. Lonnie will guide folks through this powerful American art form, where it came from, and how it informed American music that came after it. You can buy tickets now on Eventbrite and enjoy the show with Lonnie, but you can also join Choir League. The group meets weekly for practice at local breweries and distilleries. Singers can sign up for 6 to 8 week sessions, and there's always a performance at the end of each cycle. There's no audition to join and no experience necessary. Tickets for the May 4th show with Lonnie Norwood are on sale now at Eventbrite. Just check the link in our show notes. For more information on the program and joining the choir, visit choirleague.com or email info@choirleague.com. So your investigation really laid out all of these different components and issues that are happening sort of all at once here. There's this increased need for mental health services. There's this funding system that seems to be broken. And there's this network of mental health care centers that say they're underfunded.
Yeah.
And obviously some major mismanagement happening. What do you think is the core problem? What did your investigation, what struck you?
Yeah. Well, it strikes me, you know, in the aftermath of this series that the mental health centers and their lobby and their proxies are all saying, well, you know, you're only doing this because you're trying to shut down the community mental health centers. I mean, I interviewed a ton of people. Nobody's suggesting, you know, burn the house down. What people are suggesting, and what strikes me, what jumps out to me as a really pretty doable thing, is for the state to, you know, stop being pushed around by the lobby, the trade association representing these centers, and consolidating their power and fortifying their power, and start literally regulating and overseeing them and requiring transparency and requiring accountability. And what's so frustrating about this, and this was going on as I was reporting the series, is that there's this new state department, like a cabinet level state department, to be created in July. It's being created purportedly to address these questions of transparency and accountability. But when you look at some of the recommendations that a huge task force that sort of met around these issues and made priorities about, they're ignoring some of the priorities that the task force sent, and really, you know, siding once again with the community mental health centers in allowing them to skirt transparency and skirt accountability. For example, like if you're Summit County, which is part of a center called Mind Springs, but it's Mine Springs has 10 West Slope counties in an area the size of West Virginia. I mean, just huge. And so you want to know how much they're spending in your county, right? And even how many care providers they have in your county or how many people they served. Mine Springs doesn't tell them. I mean, it's so maddening for them, right? And so when, I'm talking about these lofty words like transparency and accountability, the most basic transparency would be that they have to answer that, right? And so that there would be someone in the state or someone provided by the state who's an alternative to the center who makes sure that if you're Matt Vanola or his family, that he is not going to fall through the holes of this safety net. And that is called care coordination. And that was a main priority for the task force that was envisioning and recommending the priorities for this new State Department. And that's been pretty much trashed. They won't admit that, but it has. These centers aren't used to being challenged at all. And there's this sense of entitlement that they should be the only game in town, and a sense of entitlement that they should not be scrutinized or criticized or asked to do more. They're so indignant about this. And so what stands out to me is how relatively easy it would be if the state grew some kind of backbone to do this. And just the weird kind of, how dare you question us attitude you get when you do.
Especially when you're not even getting the work done.
Yeah.
So since this has been published a couple of weeks ago, some things have happened. Can you talk about what the impact of your story has been?
Yeah. Mental Health Colorado, which is the organization the biggest organization in the state that advocates for people with mental illness, wrote a very demanding letter to the administration calling for the kind of accountability and transparency measures that we were talking about. And an increasing number of county commissioners and county sheriffs and other administrators are signing it all over the state. This will be a real focus of the legislative session, and I think that from now until May, there will be a lot of conversation about maybe a different, more person-centered, public-centered, and less center-centered system.
Susan Green, thank you so much for joining me.
Bree, thank you for reading it and caring about this issue. I really appreciate it.
And here's what else is happening in Denver today. The Breakfast King is no more. One of the last remaining late-night diners in Denver proper closed its doors yesterday without notice. The Colorado Sun reports that apparently the owner called up current employees and told them not to come in for their shifts. What a giant bummer. That's all for today here on CityCast Denver. If you enjoyed the show, why not take a minute to tell a friend about us, rate the show wherever you get your podcasts, and subscribe to our morning newsletter. We'll be back tomorrow morning with more news from around the city. See you later. Okay, do you want me to do this newscast item again?